Cardiovascular morbidity and obstructive sleep apnea. Obstructive sleep apnea, a relatively common disorder in adults, is characterized by sleep-related periodic breathing, upper airway obstruction and asphyxia, sleep disruption, and acute autonomic arterial and hemodynamic perturbations. Epidemiology data show a strong association between untreated obstruction, sleep apnea, and incident cardiovascular morbidity and mortality. However, obstructive sleep apnea is typically identified along with cardiovascular, metabolic, and inflammatory disorders, and this complicit association confound interpretation of the implicit and explicit association between the treatment and obstruction sleep apnea and cardiovascular risk and outcomes. The primary markers study were systemic arterial blood pressure and the level of C-reactive protein. Study by Gottlieb, which used blood pressure as the primary outcome. The design was derived from the explicit concern that repetitive hypoxemia and reoxygenation in obstructive sleep apnea propagates chronic systemic hypertension. Most participants also had systemic hypertension, coronary artery disease, but not heart failure or both. Participants underwent randomization to one of the study groups, in which they received 12 weeks of healthy sleep and lifestyle education alone or addition to either CPAP or natural supplemental oxygen. Study by Chirinos. Primary analysis excludes patients we did not adhere to the regimen for CPAP therapy. Efficacy can also assess with the use of intention to treat analysis. The mode of finding were that CPAP alone did not lower CRP levels significantly, but that the weight loss intervention and combination therapy died.
If you have obstructive sleep apnea, your breathing pauses for brief periods while you're asleep. Normally, when you breathe in, air flows in through your mouth and nose and down your throat, also called the pharynx. Air then flows down your windpipe or trachea, spreading through a tree-like structure of smaller tubes into your lungs. Each time you breathe in, negative suction pressure pulls the soft tissues in your mouth and pharynx inward. The muscles in your pharynx respond by pulling the soft tissues outward again, which keeps your airway open. When you sleep, it's normal for the muscles in your mouth, tongue, and pharynx to relax slightly, but not enough to block your airway. If you have obstructive sleep apnea, the muscles of your mouth and pharynx may relax too much. Your tongue drops onto the soft tissue in the roof of your mouth, pressing it against the back of your throat. This completely blocks the flow of air into your lungs. The lack of oxygen in your lungs wakes you up. You may gasp for air to re-establish airflow before falling asleep again. The cycle of apnea and waking up